South Africa has ordered 1.5 million doses of the AstraZeneca vaccine to inoculate the country's health workers. A more contagious coronavirus variant in the country is driving a second wave of infections, overwhelming hospitals. This week, deaths from COVID-19 surpassed 30,000. Now, DW's Adrian Kriesch visited a hospital in Cape Town where doctors are having to improvise to save lives.
This isn't a waiting room, it's the treatment room for COVID patients at the hospital in Khayelitsha. One patient calls out to us to tell us she'd been sitting and waiting for 3 days, waiting for a bed to become free next door.
These one are too weak to sit on a chair, so we put them on the stretcher, and they are all on oxygen.
Dr. Susan Mukonkole has been working here for 9 years, and this pandemic is pushing him to his limits. A third of his colleagues here have already had the virus.
How do you feel to see your hospital that full?
Sometimes you feel powerless because you don't have enough space. Sometimes we don't have enough oxygen points. We need to improvise and see how we can split 1 point into 2 to give oxygen. Sometimes you have to choose to who do you give first the oxygen and who should wait. That sometimes is very stressful for this.
On average, one person with COVID dies in the hospital every day. There's a small room next door with somewhat better beds for acute patients waiting for an intensive care bed at another hospital. The local health minister admits that not everyone can get an ICU bed. Most are already full.
If the person qualifies for the ICU, it depends. But remember, even prior COVID, for ICU entry, there's always a scoring index. Yeah. The house is on fire.
So this is actually the waiting hall, the waiting area of the hospitals where people would normally wait for their treatment, but you can see it. People who come here with non-COVID related issues, emergencies, are for now being treated here because they need the space on the other side of the building for potential COVID cases.
South Africa, meanwhile, has reintroduced tougher lockdown measures. There's a stricter mask requirement, alcohol sales are banned, and beaches have been closed. But police are overwhelmed with enforcing the rules. Only patients over the age of 45 are now being tested at the state clinics. The demand is overwhelming. Here in virologist Wolfgang Preiser's laboratory, every second test is positive. The peak of the second wave is expected in South Africa in mid-January, but even after that, experts anticipate further waves.
I fear that neither the current enormous surge that we are experiencing now, nor the arrival of a vaccine sometime into halfway through 2021 for a small proportion of the population will be able to make a big difference.
The government announced it is already in talks with vaccine manufacturers, but there are no details yet. Back in Khayelitsha, however, there is hope. Initial studies show that during the first wave, up to 40% of residents were already infected and possibly even immune. Social distancing remains impossible for many here. Dr. Mukonkole and his team are therefore still bracing for a tough few weeks ahead of them.